Okay, guys, let's go. So, what is next question? Next question, I see it's about mitral valve stenosis. Okay, let's go. About mitral valve stenosis. So, okay, what is mitral valve stenosis? Mitral valve stenosis is a heart condition characterized by narrowing the mitral valve opening, which obstructs the flow of blood from the left atrium to the left ventricle during diastole. So we remember, I suppose, the relaxation phase of the cardiac cycle, so repolarization phase on ECG. So this narrowing results in increased pressure in the left atrium and can lead to various symptoms and complications. So about etiology, the primary cause of mitral valve stenosis worldwide, of course, is a rheumatic fever and inflammatory diseases that can develop after an untreated or actually inadequately treated streptococcal infection. The cause of the rheumatic fever. Other less common causes include congenital malformations of the mitral valve, it happened, calcification of the valve due to aging, so-called degenerative changes, and less frequently infective or infectious, but correctly, of course, infective endocarditis or autoimmune disorders. Rheumatic fever leads to the formation of scar tissue on the mitral valve leaflets, causing them to thicken, stiffen, and fuse together. This process, my beloveds, yes, fuse together. This process narrows the valve whole orifice, restricting the flow of blood from the left atrium to the left ventricle. Calcification of the valve leaflets can also contribute to stenosis. Over time, the increased pressure in the left atrium can lead to enlargement of the atrium and hypertrophy of the left ventricle. Patients with mitral valve stenosis may experience symptoms such as dyspnea, so it's a heart failure sign, especially on exertion, fatigue, orthopnea, shortness of breath when lying flat. Now, of course, because blood comes to heart, preload. Paroxysmal nocturnal dyspnea, sudden awakening from sleep due to shortness of breath, palpitations, hemoptysis, coughing up blood, and signs of right-sided heart failure, such as hepatomegaly, and hepatomegaly is an enlarged liver, if you remember, and peripheral edema. So about diagnosis. Diagnosis is an echocardiography, imaging techniques. Both transthoracic and transesophageal echocardiography are used to diagnose mitral valve stenosis and assess its severity. Chest X-ray can reveal signs of left atrial enlargement, pulmonary congestion, and in advanced cases, pulmonary edema. It doesn't matter. Any imaging techniques. The most cheapest one is, of course, echocardiography. If you want chest X-ray, MRI, computer tomography, up to you. Concerning ECG, yes, may show signs of left atrial enlargement and atrial fibrillation. Of course, we remember that from atrial fibrillation. Concerning management or treatment, medical management, we've got symptoms relief may be achieved with medications such as diuretics to reduce fluid overload, beta blockers or calcium channel blockers to control heart rate, and anticoagulants to prevent thromboembolic complications, especially in patients with atrial fibrillation, whole life medication. Then interventional procedures, so invasive procedures, interventional procedures. Microsurgery, micro and micro balloon valvuloplasty may be performed to dilate the normal mitral valve in selected cases. Surgical interventions such as mitral valve repair or replacement, so micro and macro surgery. that is surgical intervention such as mitral valve repair or replacement, may be necessary for severe stenosis in patients who are not candidates for valvuloplasty. Antibiotic prophylaxis actually is a controversial, but sometimes patients, not sometimes, but if it's we talk about rheumatic fever, patients with history of rheumatic fever or mitral valve stenosis are at increased risk of infective endocarditis. We know that, and should receive antibiotic prophylaxis before certain dental or surgical procedures. So anyway, it's in fashion that any stomatological procedure goes with antibiotics prophylaxis. So it's largely sufficient for your answer on the big state exams. So God bless you. See you in the next lectures.